In this teaching video, we're going to talk about the #1 tool that I used to help these bright, hardworking kids get over their learning glitches when I was teaching in my special education resource room classes. It is, of all the things that I've talked to you about, is the #1 change-making agent that I saw, and that is the Brain Integration Therapy Manual. The Brain Integration Therapy Manual was developed, I put it together from many thoughts by other people who are much smarter than I am, who came up with how to really make changes in children. I am so excited about this Brain Integration Therapy Manual. If I had nothing else to use, if I wasn't a nutritionist and didn't know those kinds of things, if I didn't know right brain strategies, if I knew one thing, that was brain integration therapy, I would know I could make a change in a child's ability to process. This is the core. It's the core of my program. Yeah, what I found is that when I use brain integration therapy, it removes learning blocks to 80%. The amazing thing is I was in special education. I received a master's degree, so I knew a lot of strategies, and I knew how to help a child compensate for their learning difficulties. What I didn't know is how to remove those learning blocks. When I remember first learning this 20 years ago, and I learned that there was a body-brain connection, that we could get, like dyslexia and writing issues, could get stuck in muscle memory, and that we could do midline therapy to make both hemispheres connect. Excuse me. And when we did that, we would make a profound change in how that child processed information. We made such changes using this Brain Integration Therapy Manual. My partner, my teacher across the hall, who also had a resource room, and I, who did this Brain Integration Therapy with our students, sometimes they were second grade all the way through 8th grade. We made such changes that I remember one time the director of special education came out to our school, and she talked to the principal, and she said, I really am concerned that these two special education teachers might be teaching their children the Woodcock-Johnson test, because we are seeing more results. They are making faster growth by 5 times than any of our other teachers in the district. So the principal came and talked to us, and we said, you know what? It would be so good if someone else would start giving the Woodcock-Johnson test, or a different kind of assessment, and just see, because we'd like to know too. Are we maybe influencing the test by just doing nonverbal cues when we talk to kids because you care about them a lot? It's an easy thing to do without knowing it. Well, they tested them, and they found the same thing, a 2-year growth. It was the first time we'd ever seen that. Well, then I knew that what I learned from Dr. Dennison and people much smarter than I am, Drs. Doman and Delicato and Dr. Getman, that the midline of the brain was a big piece of processing glitches. And when I learned that and started putting into practice, I put it into practice first for my son, who was at home being homeschooled, and then when I went back into the school, I used it. Well, I always say, once you've seen Paris, you can't go back down on the farm. Once I knew that this began removing learning blocks, not just compensating for them, and I could get a 2-year growth, I couldn't go back to just slower, louder, multiple repetitions, different curriculum, sandpaper letters, clay letters. I couldn't go back to that anymore because I learned a new way, and I'm going to share that with you. This revolutionized my entire program, and I still use it all the time. We're going to talk #1 about brain integration therapy, but just to know, we have talked about 3 parts. When people come to a consultation that I have in Child Diagnostics in Denver, I film for them and show them 3 parts of learning. The brain integration, which is the #1 therapy. Then I show them right brain strategies to help them so the child can remember pictures of words right away. Then if a child has, like a young man I had yesterday, he had mainly behavior issues, focusing issues. He had meltdowns. He was diagnosed with ADHD, anxiety disorder. For that, I use the Biology Behaviors CD set, and that has a 3-month nutritional program in. So by the end of 3 months, we should see the nervous system of the child be healed again by 80%, so they don't have meltdowns, they can remain focused. Even this mom had she had tried about 4, I think she said 5 different medications. Each one overstimulated him. Each one caused ticking because his nervous system was so distraught. We needed to find out why. And of course we did. We found out the why. That's in the biology behavior. So in some of the earlier teachings we did, the daily lesson plans for the struggling reader, the daily lesson plans for the struggling writer and speller uses brain integration and right brain strategies. So let's look at this brain integration therapy manual. Why would you consider getting it? Who needs it? We know that in the 1960s, Drs. Doman and Delicante were 2 neurologists, and they came up with the idea that the midline creeping crawling would make connections. They originally came up with this for babies and kids who'd had in utero brain bleeds. As a result of that trauma, they had speech issues, and they found they could reconnect what we used to think was brain damage. We now found it's almost like disconnected wires. Well, now we know dyslexia wants to be disconnected wires. Dysgraphia wants to be disconnected wires. Auditory processing wants to be disconnected wires, and we can reconnect them using the body, using midline therapy. And there's a lot of midline therapy out there. What I like about this approach is I could use it in a school setting because nothing ever took more than 20 minutes a day. It wasn't hours a day. No one had to get on the floor and crawl. We could use the proprioceptor muscles to impact and make connections.